Hello everyone, welcome to the lecture series on livestock and poultry care. I am SUCHIT doing undergraduation in the University of Agricultural Sciences, Dharwad. Today I am dealing with the topic called hematuria and hemoglobinuria. So, what is hematuria? Hematuria is the presence of blood in the urine. It can occur in the cattle and may indicate any underlying health issues. Here's some information on symptoms, diagnosis, and treatment of hematuria in cattle. And what are the symptoms? The symptoms include red or discolored urination, increased frequency of urination, straining during urination, and reduced appetite and lethargy, which means the lack of energy or inactivity. Okay, here in the image we can see that the red colored, discolored urination. It is due to the presence of blood in the urine. And in the right side there is a sample vial in which the urine is collected for the clinical diagnosis. The diagnosis includes physical examination, urine analysis, blood test, and imaging test techniques. What does imaging technique includes? It includes CT, MRU, ultrasound, and many others. You can see in the image that there is an infectious urinary bladder on which the black color tumors present. On the right side, there is an infectious urine in the reproductive tract. Overall, it's a complete image of the bovine enteric hematuria in the cattle. So, what are the treatments for hematuria? It includes antibiotics like amoxicillin, anti-inflammatory medicines like ibuprofen, elimiron, fluid therapy, dietary changes. The should not include the oxalate concentration in the vegetables like lettuce, carrot, citrus, etc. Then other treatment will be the surgical intervention. Now, let us talk about hemoglobinuria. Hemoglobinuria is also called as hypophosphatemia. It is a metabolic disease which occurs in the highly lactating cows at 6 weeks after parturition. In the buffaloes, it may occur even before or after the parturition. It is characterized by the hemolysis, that is the breakdown of RBC, then anemia, that is the loss of the blood, and overall loss of the function of a cattle. You can see the symptoms where due to the loss of the function of animals they are just laid down on the floor. The mechanism and cause are not really understood, but the severe drop in the serum results in a secretion of milk, and intensive milk production may predispose to the condition. Heavy feeding on the oxidative plants and plants with low phosphorus may predispose to the case. Animals in third to fourth lactation are more prone to disease when compared to the first and second lactation animals. Clinical signs includes inappetence, which means lack of desire, severe decrease in the milk yield, hemoglobinuria in the next day. Affected cows may have fever, diarrhea, tachypnea, which means the abnormal breathing problem. Signs of anemia includes pale mucous membrane, icterus or later on, which the nothing but the jaundice. Acute cases stays for 3 to 4 days, then the cow becomes severely dehydrated and weak. Cows may die later on from anemia anoxia, which means due to the lack of oxygen, there will be a loss of blood. Non-fatal cases recovery occurs after 3 weeks with a rate of 10 to 30%. The image shows the clinical diagnosis for the hemoglobinuria, where the urine strip dipstick is positive for HB. Here, if the light green or the green shows the lack of hemoglobinuria, and the other color shows the severity of the hemoglobinuria in cattle. The diagnosis includes case history, time of calving, time of occurrence, and plan of nutrition should be identified. Clinical signs includes sudden appearance of hemoglobinuria 4 weeks after calving, which is a period of high lactation. Then normal to moderate rise body temperature. Laboratory serum phosphorus should not be less than 4 mg per deciliter. Low RBC and HB. PCV, which means packed cell volume test. Here the urine should not exceed in the metabolism of bilirubin. The treatment includes intravenous injection of sodium hypophosphatine, tonofos 150 ml, Bone meal should be added to ration of cows. Blood transfusion should be attempted in severe anemia. Okay, here you can see the 4 days treatment of the buffalo. During the first day of presentation, there will be a completely dark red color urination. During the second day, also there will be a dark color urination, while in the third day, there will be just red color urination. And during the fourth day of the treatment, there will be complete normal urination. So how we can control it? We can control it by paying attention to the phosphorus content of ration at the beginning of the lactation itself. Phosphorus supplement or bone meal should be added to the ration. Okay, friends, thank you. If you all feel it's a useful video, then please like and share it.